Yeah, I'm actually going to start this with a 3-minute video from China describing, what they've done on the coronavirus. Okay. It summarizes much better than I could.
COVID-19. Wuhan, a metropolis of 11 million residents in central China's Hubei province. This winter, the city is fighting an unprecedented defensive battle. The enemy is the novel coronavirus. By January 23rd, there were 495 confirmed cases in Wuhan. To minimize the spread of the virus, the city, with a population 1.3 times that of New York, was locked down. China then began a large-scale rescue mission. On January 24th, the first batch of medical teams from outside Hubei arrived. Meanwhile, Chinese companies were ordered to build a 1,000-bed hospital within 10 days, and a second soon followed. On January 25th, China held a top-level meeting on the outbreak, and confidence in winning the battle was expressed. Unfortunately, the disease continued to spread. By February 2nd, the total confirmed cases in Wuhan surpassed 5,000. The next day, the construction of 3 temporary hospitals began. Since February 7th, the Chinese government has called on 19 other provinces and municipalities to send medics to cities in Hubei. On February 9th alone, 6,000 medical workers landed at Wuhan's airport. On February 11th, the total number of confirmed cases in the city neared 20,000. 2 days later, the Chinese Air Force sent cargo planes carrying 1,400 more medics from the army. Over 1,500 medical workers have been infected, and some laid down their lives to save others. To plug a shortage of protective suits, masks, and other medical supplies, Chinese manufacturers from various industries were mobilized. The daily capacity of mask production was raised from 8 million to over 50 million. Huge volumes of material supplies headed for Wuhan. By February 23rd, China had dispatched over 330 medical teams, incorporating 41,600 medics to the virus-hit Hubei. Wuhan has built 2 infectious disease hospitals, increased the number of designated hospitals to over 40, and put in use 13 temporary hospitals, bringing the total number of available beds to over 40,000, while preparing another 70,000 beds at quarantine sites. No one is left unattended. Fortunately, new confirmed cases in Wuhan have finally started to decline. The dawn of victory has appeared. WHO Director General Dr. Tedros Adhanom Ghebreyesus said,
Its source appear to have bought the world time, even though those steps have come at greater cost to China itself.
It is a special war between humans and a new virus. Defending Wuhan is protecting China and the whole world. No victory should be hastily announced until there is a complete win.
So I thought that was sort of an interesting way to start this discussion. You won't remember all those numbers, that's okay. But it's inconceivable to any crisis that we would face here. It's absolutely beyond the scope of what we know we could expect. They can move that many military forces around the world in a war. But to save lives in any kind of a medical crisis, it's really not on the agenda. So this is a new development. It's going to have a worldwide impact. It's going to have a huge, as Larry was saying, economic impact. It really could very much precipitate a global economic crash in the severest way. And the capitalist economy has been teetering for several years now. and since 2008 has been on life support. So at what moment and what would push it over the edge? It doesn't take much, but certainly a complete lack of confidence in the system, along with a disruption of supply chains, along with the capitalists feeling their profits are threatened. That could upend a lot of things. So what's our response to this? And that's really what we want to talk about. And we want to talk about it even in terms of all the politicians and what they're saying and what they're not saying. And are there demands that we can make where we can even push this forward, particularly in a period like this? See, unless we're thinking about it, demands, then we don't have a way of intervening. Now, the first thing that happened in the U.S. before there was even one sick person was there was an epidemic of racism. There was an epidemic that just went mass of anti-China racism in the most disgusting, going back 100 years and to the most current. And it impacted even every Chinese restaurant in the U.S. They talked about how business was so down, and along with kids being barred from schools and offensive attacks on subways and in shopping centers. So that's before anyone was sick. That's where the media goes. What happens in a crisis? What's their go-to? It's to create fear. It's to create panic. It's not to give any real information. And it's to use racism to divide. And that's really important to know before we're even looking at any figures. Now, the next step was Trump actually ridiculing, saying, well, this is really just a hoax from the Democratic Party. Now, that means even any government agency that wants to take action knows that they face complete hostility from the White House on this. And that acts to just stop everything. What finally woke them up was the stock market going down. And that's what they talked about. The stock market was going down. It wasn't anything about lives. It was their profit. And so the Federal Reserve had to take emergency action. For that, they would take emergency action and pump more money in and actually lower the interest rates to build capitalist confidence. I mean, it's really obscene when you read this and you see this response. And then it had their attention. Then they all would come out again and talk a little bit more about what they were going to do. There's still no discussion about health insurance. The first thing and most important thing that China did in terms of a quarantine was they put a freeze. This is just incredible. I don't think we can even conceive of this happening. But everyone's credit card, and everyone uses a credit card in China, everyone. Credit card bills, rent, mortgages, car payments, everything was frozen. If you're going to quarantine people and they can't work, how are they going to pay for anything? I mean, it's almost so obvious, and yet it's inconceivable here. You couldn't imagine one landlord accepting this, one bank accepting this. That would create a real economic crisis, wouldn't it? I mean, it would create a meltdown. But it's an important demand. It's a really important demand that as a working class, we should be thinking about. Then there's the test kits. They quick distributed a whole bunch of test kits that they had spent millions of dollars. Somebody here may know the figures, but millions of dollars on, and they didn't work at all. So they had to recall them, and there's a whole new set that's coming. And then folks who insisted on being tested found out that they were charged thousands of dollars just for a swab, right? Because the test went here and went there and a doctor had to come out and do it, whatever the reason. The reports were coming in of $3,000, $5,000. If you had insurance, it was a mere $1,000. This is half the population in the U.S. does not have $500 in their pocket to pay for an emergency, including an emergency that will save your life or your child's life. So when you face bills like that, you try to avoid it and say, okay, I'm going to wash my hands and I'm going to take vitamin pills and all of these other things which are now being advertised all over. You see an article for coronavirus and down the side you see like 10 different, articles promising you cures that you can buy over the counter. And they're all fabulously expensive. Along with, you can't get any kind of disinfectant. I mean, just for basic, we got some alcohol swabs just to wipe the keys of the computers here, the phones, the mouse pads. That's basic stuff because we're all using this, right? You can't buy these supplies. You really, we found some in the first aid pack, right? And they're selling them online at hundreds of dollars. I mean, it's incredible. So this is exactly where it's the other go-to of capitalism. It's immediately speculation. It's racism, and then it's shortages and speculation. So workers' demands, that's really the thing I want to address. And I tell you, I was so excited. I cried about this. I really was so excited, so happy. And that is the Boston bus drivers put out some real demands. I'll find this. This is Local 8751, District 4, Steelworkers. This is the Boston bus drivers. And it's important. They put it out to the international, they put it out to the national, they put it out, of course, to the drivers. And it was demanding basic things. And it said, look, there's schools that are closing, there are conventions that are being called off, there are airlines that are not flying. What do we need? And every driver and the custodians on the buses, the caretakers, is that the term? All need training. And the bus on every route has to be disinfected. And if you get sick, you have a right to full pay. If you're supposed to be quarantined for 3 weeks. So these kind of demands are very, very important. I gave it out. It's the inside of your packet. But it also says that the company has a responsibility to prepare a stockpile of protective masks, gloves, cleaning materials, along with training. See, the training is the most important part of it, and an orientation to the workers, because these are workers who are interacting with children. They say, we have the most precious cargo. Hello. Disinfecting the buses, the work facilities, the workplaces, updated literature, reports from the city, from the CDC, from the World Health Organization. And should driver or their families become exposed to the COVID-19, and that is the scientific name for coronavirus, and we should try to use COVID-19 more and more, because coronavirus is and certainly not Wuhan virus. Whenever they say that, you just know that they're like blaming China for a virus. Now there are millions and quadrillions of viruses in the world, and they're mutating and changing all the time. I want to get to some of the U.S. figures, because there have been 12 deaths from that they know of, that they're reporting, of the COVID-19 virus. No attention to the 60 to 80,000 people who died last year of the flu virus. Now, how many of them really, it was a flu that led to pneumonia, and you don't go to the doctor. You don't go to the doctor till you're really almost dying and it can't be reversed. That's how most of those people died. And yet there's no publicity, there's no attention. So unless there are real demands that the working class is making for accountability, then we're defenseless to panic, to racism, to division. And it's an important time to be raising it to these candidates. I mean, there should be real pressure on the Sanders campaign from within and from outside and at Sanders rallies to say, this is what we need right now. Call for it. Call for it. It would be important. It's not just a vague general health care for all. Yes, we need health care, free health care for all right now, and connect it to what's going on. I think, really, frankly, Sanders could reverse his situation if he did something like that. It would put every politician on notice, and they couldn't ignore it. So these are the kind of things that I think, if we're thinking about and saying, could have pull within the Sanders movement, too, who we want to talk to, because these are people who want socialism, and they're certainly going to take the first road that they see. If you can do it pulling a lever, for heaven's sakes, why shouldn't you try? Especially if you don't have any experience where you've been burned again and again by that. So now, I saw demands in another place. This was an Ask Me local. Can I find it? And it was reported in Fight Back, which is Freedom Road's newspaper. They put out a series of demands for workers, for unions, of testing and treatment, mass testing and treatment free for the COVID virus. Not that you have to go through 10 hoops of your insurance company and copays and all of that. A special focus made to mitigate the impact, especially in the most oppressed communities. Now, this is really important because where are the largest number of workers, largest number of people who suffer from diabetes and heart and asthma and all kinds of problems that are made worse just in the regular flu season? So it has to be addressed specifically with a demand. This is like ABC, but it won't get raised unless we raise it. So I think thinking about this and even measuring it, there's a real reason to do this. Unemployment compensation immediately. And regulations need to be revised so you don't have like what is it now? It's a 6-week waiting period, right, to get your first check if you get officially laid off from a job. What does that mean in a quarantine? There are lots of workers who are being told to work from home. Lots, right here today. But if you don't have a computer job, who especially can't work from home? It's the lowest paid workers. It's the fast food workers. It's the healthcare and home aid workers. They're the ones who are getting almost no pay, don't have health insurance, and can't work from home. So if they're sick or if their job closes, what happens to them? We need real demands on that. There need to be demands, and I'm reading again from this list, which really impressed me, in terms of release of prisoners and migrants, because the prisons and the detention centers really become epicenters of infection, where people are packed in. So immediate release. This list says of nonviolent prisoners, and of which is 95% or something of prisoners, or 90%, I don't know the exact, a huge number of prisoners are not in prison for any violent or abusive crime. It's crimes against property. And then stocks of protective equipment being easily provided, healthcare workers being provided with the protective gear that they need, and price controls, and food distribution. Now, that's another really important demand. And there have been times in the past, and we were part of these campaigns, so we need to remember, where we actually did win for a time price controls on the price of milk and bread and some really basic supplies, meat. And it was a women's committee that this party founded, where we demanded, Women United for Action, yeah. We demanded that the price be stabilized because it was going through crazy ups and downs. So if we have demands, it's not that they're unwinnable. If they're raised in a time of crisis, if they're raised in a way that we can pull in allies, if they're raised by other people who also are in motion, where we're saying, this is what we want, this is what we need, this is what we need to survive. We also got to have demands that deal with the rest of the world, because it's U.S. policy that is doing more to systematically destroy healthcare around the world. Around the world. And the first thing that they do is dislocate the healthcare system. Now, the impact, the most serious in the world right now is in Iran. And it is the impact especially over the last 2 and 3 years, to just rip apart Iran and also Venezuela's health care system. It's almost impossible to buy the supplies that they used to freely have. So you can have thousands and thousands of trained doctors, and if the shelves are bare, then it's hard to really combat. So this is where the campaign against ending the sanctions and having medicines freely available on a worldwide, and calling the U.S. out. What does more to create epidemics around the world that put the whole world in danger? If you deprive medicine to a third of the world, doesn't that endanger the other 2/3 too? In all honesty, we got to say these things because viruses don't, follow politics, and yet it's highly political. So at any rate, I think we should think about this, and we should think about it when we're thinking about the candidates, when we're thinking about what's going on even to the average person who's involved and they want socialism. What does it mean? What does it mean? It means especially, and this goes back to the demands with International Women's Day, we need to live. And we need demands that are about life and about health and about food where prices are stable and easily provided, and there's a freeze on and that's another thing that can be won when there's a campaign. In Durham, just these last 2 months, they won a freeze over the winter in evictions. And then what happened March 1st? City sent out all kinds of eviction notices. Now, it does show, though, that you can win a demand. And that's important. And then it becomes a struggle to insist they not evict anyone. Clearly, they have the power. They have the power to do it. They did do it. They got to continue it. But when we think about these demands, and it goes back to Frederick Douglass, power concedes nothing without a demand. So having demands, raising them in unions, in central labor councils, in schools, and in the political movement. And among all those who want to talk about socialism, we say, yeah, let's talk about socialism. Socialism takes a fight. And this is what we have a right to.